There are new cases of a dangerous mosquito-borne virus here in the United States. Doctors say that women can pass the Zika virus onto unborn babies and that it has caused many birth defects in South and Central America. So the Centers for Disease Control is now warning pregnant women not to travel to certain countries where they could contract this virus. Dr. Marc Siegel joins us now to explain. Professor of Medicine at NYU Langone Medical Center and a member of the Fox News Medical A-Team. Doctor, good morning. Good to have you with us.
Hi, Martha.
Started reading about this a couple of weeks ago, and now it appears that they're more concerned about it here because of the cases that we're seeing here in the United States. We've got Texas, Illinois, Florida, and Hawaii all showing cases now.
Couple in pregnant women, one young child that they think was born with the microencephaly, small head, with an underdeveloped brain. Unfortunately, that's related to this. You know, this virus has been around since 1947 in Uganda, and it's been all over Africa and Asia, and we haven't seen what we're seeing now. So a lot of scientists are saying maybe this mutated, maybe this is a new version of this virus, because suddenly a year ago, Martha, it took off in Brazil. And we're seeing hundreds of thousands of cases in Brazil, and we're seeing, unfortunately, from 150 of those small brains, microcephaly, we're now seeing close to 4,000 cases in Brazil over the past 3 to 4 months. That's a big problem. So that's why the travel advisory for pregnant women, because we don't want pregnant women to come in contact with this virus and risk transmitting it across the placenta and infecting a young child. I do want to say, though, just to be fair here, we have many diseases that we can get by traveling to other countries. I mean, you get 2.5 million cases of dengue fever every year with the same mosquito. And we have malaria. I mean, pregnant women need to watch it anyway when they're traveling. This is worth putting an exclamation point on because it's new and because it's emerging.
All right, but people also need to understand that the people who contracted it here in the United States had traveled to these countries in Central America and South America, and they brought it with them. As far as we know, nobody has been bitten by a mosquito here in the United States and contracted this, right?
Absolutely, and the only way that could happen, it cannot spread person to person. You can only get it if a mosquito that's already carrying it bites you, and that can only happen if that mosquito picks it up from someone else. 3 out of 4 cases have no symptoms at all, so you don't even know what to look for. The 1/4 of the cases, it's a flu-like symptom. You feel joint pains, you have fever, you have a rash, you have headaches, common flu-like symptoms. So it's hard to diagnose it, Martha. You don't know if it's this or something else.
Right.
The best thing you can do to protect yourself is to use insecticide, to cover your arms, you know, with clothing on arms and legs, to watch out areas of stagnant water. I mean, you know, down in the South, the Gulf states, I'm particularly worried about it because the mosquito that carries this is already there, and there are a lot of areas of stagnant water, and there's, you know, in poorer communities, it's easier to transmit this because there's more mosquitoes around. So we could have an emerging problem with this. We really, really got to look after it now, and I'm very happy that the CDC is issuing a travel advisory. We also need to look out for it in our southern states.
No vaccine, no course of treatment yet for this virus once you get it, and there's a concern about the 2016 Olympics because they're being held in Brazil. Lots of people are going to be traveling in and out of that area due to that, of course. Thank you very much.
We're not going to see a vaccine for this anytime soon, unfortunately.
Scary stuff. Dr. Siegel, thank
you.
you.
Good to see you, Mark.
You too.